She says, every day we hear of more friends and family who are sick or have died. People run around trying to find oxygen for those who are really sick. In the rural areas, there are only 20 to 30 ventilators per district. There are 10 blocks to a district. Gururu block has about 240,000 families. Oxygen cylinders are in such short supply. One cylinder used to cost 7,000 rupees, and now they are 70 to 80,000 rupees. The scene here is truly apocalyptic.
Welcome to our latest ThinkPlace ThinkSeries. I'm Darren Menachemson, one of the ThinkPlace partners, and I'm joined today by some amazing people who have been navigating what I think it's safe to say is the largest disruption in international development the world has seen in the last 80 years, at least. The COVID crisis has been an ongoing story of tragedy and challenge, and also of innovation and inspiration, as the international development community has had to struggle with just what can only be described as a totally different landscape. With the latest COVID surge in India, we've been hearing difficult stories from many parts of the country as the pandemic has overwhelmed medical and supply chain capacity. It's the latest in a long series of country contexts that have had to face down the COVID crisis. With me tonight are Wendy Royston and Graham Batterbury from an Australian founded NGO, WEIV, which stands for Women Empowerment in Indian Villages. And we also have our own Carlyn James, Executive Director of ThinkPlace Global Development. And each of these people have got a unique perspective on the international development challenge that is the COVID context. Wendy, Graham, Carly, welcome.
Thank you.
A pleasure to be here.
Basically, our staff go around from village to village and have talked with them and educate them about child marriage, safe birth practices, etc. They're village people, and so we have taught them and helped them to sort of really understand how to become professionals, which has been a real learning for them as well. It's very effective, the program. We have a much higher rate in the area working in this one block, have a much higher rate of girls not getting married, until they're 18 at the very least, and of women waiting for 3 years till they have their first child after marriage and spacing them 3 years apart, and all of those sort of things. And we've got the men working with the young adolescent boys and working with them around basically respect for girls and women, starting with their mothers and their sisters and their future wives. That's mainly what our focus is. We have 21 staff, local Indian women who live in the villages. We've got actually 18 women and we've got 3 men who work in the different areas that we're working in.
At the very start, India was extremely lucky because we were expecting a huge impact of the coronavirus. And in the major metro cities, it was huge indeed. And even with the remote workers returning to their villages, it didn't really break out in the villages to any great extent. Nevertheless, our staff were all off for 6 months. They didn't resume in person until the 29th of September. But in the meanwhile, they were contacting the teachers in the 8 literacy centres, were contacting the students by phone and what other means they could, just to keep their awareness going so that they didn't lose the impetus that they'd developed so far.
Once the girls went back to the literacy centres, we have a program that spans over 3 years, and they're just basically doing Hindi, English and basic maths, just to start, And once they finish 3 years, the idea is that they go on to the government schools. And we were so excited once they'd gone back after COVID, because some of our girls were actually ready to start going to the government schools. They started getting their uniforms, which our teachers first paid for, and then we needed to pay them back, etc. And then COVID hit again. Some of them had done 1 or 2 days at the government schools. and then, it couldn't continue, which is such a shame because they had this real momentum. Wow, we've made this next step.
There's no real predictability about it, is there? So
No.
you don't know when it can restart or what that's going to look like.
Not at all. No.
And the teachers did say that, some of the students had really forgotten quite a lot in the 6 months. So they were sort of building them up again. And now we can't even ask the teachers at this point to do the teaching because they themselves are sick. We've got a couple of teachers who've got COVID, one of whom has Hep B, and she's sick, her husband's sick, her son's sick. So we can't ask anything of them at the moment to actually, start phoning and talking to the students. That will come at a later stage again.
I do want to bring Carlyn James into the conversation. What has the last 12 to 18 months looked like?
I'm currently serving as the Executive Director of Global Development, so I'm sort of a cross-cutting support role across our growing portfolio of work in international aid, development, the humanitarian space, etc. We're doing a lot of work in sexual and reproductive health, maternal and child and newborn health, HIV/AIDS, malnutrition, undernutrition, stunting, those sorts of topics. So we're doing a lot of work in that space, but also in financial inclusion and in many other sort of sectors and industries. With the last little while in COVID, I know it's been a roller coaster for so many people in terms of our professional lives. The Kenya office, where I spent about 4 years, is doing great now, but is currently in its third wave of COVID, and many of our staff have experienced it, but they've also had access to vaccinations recently. Senegal, where we were fortunate enough to open up a new office during COVID last year. It's just sort of getting off the ground. They're doing well, small team. But Senegal, as you probably know, has outperformed a lot of wealthier nations in terms of its really fierce response to COVID. So it's been an interesting contrast between the two, for sure.
What's your observation? Why is Senegal doing so well when so many other countries, probably with better infrastructure, have had a much more difficult run at this?
A lot of Central and Western Africa is coming off of the back of Ebola and other sort of outbreaks, and so there is sort of a basic level of infrastructure and preparedness that's already there. But with Senegal in particular, they've had a lot of really strict mask wearing standards and things like that from the beginning, which has really helped accelerate their recovery.
What does it look like to do high quality research in a world where COVID is making everybody socially distant and unable to travel?
I think we've had a range of activity from kind of adapting what we already know and what we do best, and just trying to sort of adapt that within the constraints that are in front of us, and then also sort of rapidly developing entirely new bespoke tools and methods and techniques. So a good example of that would be a methodology we've been referring to as design by distance, where we actually are able to conduct research and prototype and test interventions, potential solutions to problems within an analogous setting to the one where we expected the actual solution to be implemented. That allows us to sort of test and conduct research and prototype solutions in the areas where our teams already are present and embedded. And it's a little more convenient, but we can deem certain aspects of it analogous based on certain criteria. And then if and when travel restrictions open up and they're lifted, we can then test the prototype in situ. At that stage, it's already a little bit more developed.
You're talking like this has been a very smooth transition, but I imagine it has been anything but smooth. So really fantastic to hear some of that. Wendy, I might come back to you. You've been in touch in quite an intimate way with some of the people who are going through the current COVID surge in Bihar region in India. And I might invite you just to take us there. Tell us what are you hearing, what are people experiencing, and what are some of the stories that are coming out of your connections?
The last time we were there, we encouraged, and they all did, to our staff to buy smartphones. So now we are actually able to communicate with them via WhatsApp, and then we use Google Translate because we don't speak Hindi. And occasionally, if we need to talk to someone, then we have somebody to help to translate for us. So I just asked the staff, what's the situation for you? And these are the sort of responses I got from one of our staff members called Ashok. Corona is widespread here in every village. 5 of my relatives have passed away. 2 of my brothers were sick and are recovering now. I am also COVID positive, as is my wife, my son and my daughter, slowly recovering at home. There are a lot of cases around our house. Then Sunita, one of the other staff members, says, there are no facilities in the villages for doctors, medicine or food. Even vaccinated people are falling sick. People are afraid and not getting themselves vaccinated. There are no facilities at the local government primary health centre in Gururu town. Patients are kept in a room in the school. There is no management of timely food or medicine for them. People are dying there. People are scared. Some died due to heart attack. The government has failed us. Influential people go to Patna or Delhi, but even they are dying. For the poor, it is even worse. It is a very difficult time.
Carly, I'll just jump to you for a second. This is the reality that people in development are dealing with. What's your reflection on that?
Yeah, definitely hard to hear, but also all too familiar. I think it's really kind of shine light on where are the gaps and the cracks in the health systems that we so often work in, and also in places where we're actively working, such as northern Ethiopia. There's also other political unrest and social unrest that's happening that's sort of added a new level of complexity to accessibility of these areas, let alone the lived experience of it.
What is WEIV doing at the moment to try and respond to some of the things that you've been talking about?
Sure. We've just launched a COVID relief fund to try and get some extra money above our general program costs. And because of the contagiousness of the pandemic, it's not very easy for our staff to go out. They can't really go out and connect with 3,000 plus women and men who are in our program. So what we're determined to do at the moment, what we can't really move, is to get oxy saturation meters and extra money to each of our staff members so that they have the funds to be able to buy the appropriate medicines and to help with their other health ancillary costs. And I think we'd like to support them if it comes to funeral costs, but at the moment we haven't reached that stage, but that may happen. So the basic thing is to support the staff. They can't move in amongst the community very much. Support the staff, they will support their families, and we're also helping them to also support impoverished neighbours. So if they have a neighbour, we're giving them enough to be able to help their neighbour as well. So in this way, we're just making a slightly incremental sort of move out into the community. And I think it's not until the vaccination rates reach a critical mass that then our staff will actually be able to move back out into the community. But by supporting them in the first instance, then they're strong to be able to move out further when the opportunity presents.
The difficulty of just organising the oximeters, I have been on and off for the last 2 days just trying to arrange that very simple thing of getting the meters to the staff, and finally have sourced an organisation through a friend I know who told me that instead of them being $50, they were $30 each. So, they're doable. And then how do we get them out there into the village? So Graham had a great idea. We could hire an auto rickshaw driver to go to the city of Gaia to pick them up from the shop and take them to our office. And then one of our staff members who has a motorbike that we've given him to use has said that he will go to the office. We have not, and receive them. We have not yet worked out how they will then get to the staff, because is he willing to drive from village to village, drop them off, because they're all in different separated villages? Or will the staff or one of their families come in when they come to town and go to the office and pick up one of them? But it's so complicated because so many of them are sick and the others are afraid to get sick. So, slowly, they will get out there. I know those meters will get out there, but that's how long it takes to get anything in place over there at the moment.
Everything is 1,000 times more complicated than
and more expensive.
And there's no sort of date or end in sight, so you don't know how long you're going to be operating like this.
No, we have got the next project we're working on, because we've been told that there's no oxygen at the local primary health centre. We're working on, through Ritu, who's got a cousin who's a doctor, we're looking at the possibility. She's been trying to talk to the man who runs the primary health centre about the possibility of us somehow getting some oxygen cylinders to there. There's also that level of government intractability, and when she first spoke to the man at the primary health centre, he was saying, oh no, we've got all our facilities going. Well, we know they aren't going. The staff are saying that, but he's probably been told by higher ups to keep a good face on it. So then we have to break through that so we can actually support the people,
I thought I might just give you a minute to talk about what somebody who's listening to this and wants to help should do to donate or reach out or get in touch with you. What's the next step?
Well, at the moment, as Graham said, we've got the COVID Relief Fund, and we are, as I said, looking at the possibility of getting these oxygen cylinders, and they will cost. And also, we have now agreed to send $100 to each of our staff members, but it'd be great to be able to send a bit more. So however much we can raise would be going to them for all their needs. And we've heard that they are actually really, one of them said that she had to sell a whole lot of wheat in order to be able to get what she needs. And so, there's that need. So our website is
www.weiv-india.org. So it's wave-india.org. We'll be also providing the oxygen saturation meters as well, and we're looking at the possibilities of providing oxygen. All of the money that's given to the fund is tax deductible for those $2 and more within Australia for everyone for whom that's an important thing.
We have no wages. Nobody gets paid for any of the work in Australia at all. It's all volunteer work.
Thank you very much, Wendy, Graham, Carly. It's been fantastic hearing your perspectives. I think sometimes the COVID crisis can feel absolutely overwhelming when we hear stories like the ones that you've been talking about. People do think, well, how can we actually rise to this level of challenge? And hearing what all of you three have been doing, I think, gives us a pretty inspiring answer. So once again, this has been a ThinkPlace ThinkSeries. Wendy Royston, Graham Batterbury from WEIV, and Carly James from ThinkPlace Global Development. Have a fantastic evening.